You know that frustrating, sneezy, itchy feeling that so many of us call hay fever? Well, it's actually called allergic rhinitis. Today, we're going to decode exactly what is happening inside our bodies when it decides to strike.
I mean, it feels like a full-on assault, right? But have you ever really stopped to think about the play-by-play? What's the biological chain of events that takes you from one tiny speck of pollen to a full-blown, miserable allergy attack? Well, let's follow the clues and map out that exact chain reaction.
Okay, let's dive right in. And believe it or not, our entire guide for this breakdown comes from this one single page of medical notes. Now, I know it might look a little intense, but think of it as our treasure map. We're going to break it down together, piece by piece. So, first things first, where does this whole thing even start? Every single allergic reaction has a trigger, right? An initial spark. Let's look at the very beginning of that process. So, what are we actually talking about here? At its very core, it's an IgE-mediated inflammation. Now, that IgE part is the key. IgE refers to a specific type of antibody, and you can think of it like a tiny security guard in your body. But here's the catch. In this case, the guards are a little jumpy. They totally overreact to something that's actually harmless, like dust or pollen. And it all goes down in this super fast three-step chain reaction. First, an allergen gets in. Simple enough. Second, those IgE security guards hit the panic button. And then, this is the big one. They signal these special mast cells to basically burst open. It's a process called degranulation, and it unleashes this flood of chemicals, like histamine, and that is the exact moment the battle really begins. So once those chemicals are out in the open, the effects are almost instant. We're not talking about a slow burn here. This is a rapid-fire response that your body mounts, and it's what we feel as that first wave of symptoms. And you can actually think of this whole reaction as a two-act play. First, you've got the acute early phase, which hits you within minutes. That's the BAM, the sudden intense part. But, and this is important, the story doesn't stop there. Hours later, a second, more drawn-out late phase can kick in, which totally explains why some symptoms just seem to linger forever. So what's the difference between Act 1 and Act 2? Well, that initial early phase on the left, that's all driven by that first chemical flood we talked about. It's what gives you the classic sneezing, itching, and rhinorrhea, which, by the way, is just a fancy medical term for a runny nose. The late phase on the right, though, is caused by a whole new crew of inflammatory cells arriving late to the party. And they're the ones responsible for that more stubborn, frustrating nasal blockage that just won't quit. All right, so we've got all this biological chaos happening on the inside, but what does it actually look and feel like on the outside? Let's move on to the telltale signs and see how this all builds into a pattern of symptoms we can recognize. Okay, so it really boils down to four main things, what doctors call cardinal symptoms. That stuffed up, blocked feeling, those sudden sneezing fits that come out of nowhere, that gotta scratch it now itchiness in your nose, eyes, or even the roof of your mouth, and, of course, the runny nose. And check this out, the note at the bottom is key. This isn't just a random sneeze. To really get a diagnosis, you typically need to have at least two of these symptoms for more than an hour on most days. And beyond just how you feel, there are things a doctor can literally see. You know those dark, kind of puffy circles under the eyes? Well, they have a name. Allergic shiners, and they're caused by all that congestion, or that little extra fold of skin you might see under the lower eyelid. That's called a Denny-Morgan crease. These are total classic clues. And then you've got the physical habits, the things we do without even thinking about it. That constant upward wipe of an itchy nose, it's so common it actually has a nickname, the allergic salute. And get this, if you do it enough over time, it can even leave a visible line across the bridge of your nose, known as the nasal crease. It's kind of wild, right? A microscopic little allergen can literally change our habits and even the look of our faces. Okay, so we know what it is, and we know what it looks like, but here's the thing. Not all allergic rhinitis is created equal. So now let's get into how doctors classify the condition to figure out the best way to tackle it. This is called the area classification, and honestly, it's pretty simple. It just comes down to two things: how often it happens and for how long. If your symptoms pop up less than 4 days a week, or they last for less than 4 weeks total, it's considered intermittent. But if it's bugging you more than 4 days a week, and it sticks around for more than 4 weeks, then you're in the persistent category. But how often it happens is just one piece of the puzzle. The other big question is, how bad is it? Is it mild, where you can pretty much go about your day without much trouble?
Is it moderate, where it's starting to mess with your sleep or your work? Or is it all the way to severe, where the symptoms are honestly just debilitating? Figuring this out is absolutely crucial for deciding what to do next. So, to really nail down the diagnosis and hunt down the exact culprit, that specific allergen, doctors have a whole investigation toolkit. They might do a simple nasal smear to look for certain cells, use the classic skin prick test to see exactly what you react to, or if they think something more is going on, they might even use a CT scan to get a deeper look at your sinuses. All right, we've identified the problem. So, what's the battle plan? In this last section, let's walk through the playbook for managing this thing, and just as importantly, why trying to tough it out is really not a good idea. The strategy here is usually a step-by-step game plan. Step 1, and it's the most important, avoid the allergen, if you possibly can. If that's not doable or it's not enough, you move to step 2, pharmacotherapy, which is just a fancy word for medication. From there, if needed, doctors can explore more advanced options like immunotherapy or in some specific cases, even surgery. And when we talk about medication, these are the heavy hitters. You've probably heard of antihistamines, right? They block that chemical reaction. Decongestants help with the stuffiness. But there are also things called mast cell stabilizers, which actually stop those cells from releasing the chemicals in the first place. And then you have powerful anti-inflammatories like corticosteroids, the stuff in most nasal sprays, which directly tackle the swelling. And this right here is exactly why you want to manage this properly. Leaving it untreated isn't just about being a little sneezy or uncomfortable. All that chronic inflammation in your nose can cause a domino effect, leading to other real problems, from sinus infections to nasal polyps. And it's also really strongly linked to other conditions like asthma. See, it's all connected. When you boil it all down, all of these tests, treatments, and strategies are all aimed at one simple goal. It's not always about finding a magic cure, but it is about managing the symptoms well enough so you can just feel normal again and get your quality of life back. And that wraps up our deep dive. We've decoded the body's, well, let's be honest, slightly over-the-top defense system. But it kind of leaves us with a bigger thought, doesn't it? In a world with constantly changing environments and new pollutants, how is our own complex immune system going to keep adapting? What's next for our body's defenses? Definitely something to think about.